Welcome to the Fascia-Informed Therapist podcast, designed for health and wellness practitioners interested in fascia science. I'm Amy Mayer, occupational therapist, practice owner, author, and educator with more than 30 years of experience using fascia techniques across many settings. Each episode brings practical insights and thought-provoking conversations to help you expand your skills and better serve your clients. Let's get started. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today, I am recording in a hotel room in Northeast Iowa. Since Wednesday afternoon, well, it is Sunday, and since Wednesday afternoon, I've been here because my 85-year-old father with a lot of disability was admitted to the hospital with sepsis and double pneumonia. So, of course, I came from Omaha to be with him. My mom passed in 2019, and I have two other brothers, one who lives up in further Northeast Iowa, and another one that just isn't around that much, and an older brother who's passed. So I act as my dad's healthcare and financial power of attorney because, as I said, he has been quite disabled for many years. He went into long-term care right before my mom passed in 2019. And what's interesting about my dad, he's had a progressive neuromuscular disease that hasn't been fully diagnosed. They call it Parkinson's-like, MS-like, ALS-like, but they've never been able to quite put a specific diagnosis on it. And what slowly happened since I was in high school, that was 40 years ago, this weakness has slowly crept up his body. I remember being outside with him, and he jumped off a 2-foot platform after fixing something, and his legs would not hold him up. And he got back up there and he did it again, and he thought, this is very strange, and went to his physician. They could tell something was off, but they sent him up to Mayo Clinic, and gosh, I've been at Mayo Clinic many times in my life, between my brother who had leukemia and my dad who has this. So they think that, I grew up in the country, and they think that one afternoon when my brother who had leukemia and my dad were outside, I don't know where the rest of us were, but we weren't present, and they were out in the yard doing something. My younger brother loved to garden, so maybe they were out doing that. And the crop duster flew over and forgot to turn off the spraying of the pesticide when they flew over our property. And our whole yard turned brown after that. And my brother and my dad were completely doused in that pesticide. Now, there's no way to prove that is what caused, but they were the only two in our family that really ended up with a pretty significant illness in their lifetime. Anyway, the point of my story is my dad was admitted to the hospital, and my dad is, even though he's very physically disabled, it's, like I said, climbed up his body, and over time it has gotten all the way up to his throat, his mouth. He can no longer form words easily. He has a feeding tube. Now it's affecting his eye muscles. He has a lot of double vision. But my dad is fully cognitively present. He is a funny, compassionate, very loving person. And I'll tell you a quick story so you kind of get the kind of person that he is. He's always been comfortable using a computer. But even after his voice started to go and he couldn't speak clearly, and it would take a lot of patience to understand him. He overheard one of the staff, the newer staff at his place of residence, which is a wonderful, wonderful facility that he lives in, and kind of getting chewed out by this other staff member. And he saw how much it hurt that staff member's feelings. And he went back to his computer and he typed out a Word document. This makes me get all choked up. But he listed out all these wonderful things that he's seen her do. And these wonderful qualities that she has. And he said, you know, you might have made a mistake. I don't know what happened. But please don't forget that you're that you're all these other things. So that's my dad. You know, he's, like I said, fully cognitively present, but now he's in a body that one of the physicians that came in, or not, one of the nurses, sorry, that came in said, is he bedridden? Is he in bed all the time? And I'm like, no, he operates his own power wheelchair. And he's like, oh, is his body always like that? Because my dad is now in the shape of a chair. His hips and his knees and his ankles are at 90 or more in the shape of a chair because he has so much spasticity in his body. And he has had so much physical therapy and occupational therapy over the years. And they do a reasonably good job of stretching. But he's sort of stuck in that position. So what the frustrating part of and the reason that I feel like I have to be here when he goes into the hospital is because I'm his voice. I'm his advocate. And people make a lot of assumptions about somebody with that level of physical disability. And when he tries to speak, it's very difficult to believe that he is fully cognitively present. And they make that assumption, and they go up to his bedside and they lean into his face and they speak really loudly because he's 85 and he has disability. And that's so frustrating for him. When he first moved into long-term care, that's exactly what the nurse that was admitting him and it was going to be in charge of his care was doing to him. And I could see it. And the nurse left the room and Dad said, you have to talk to her. You have to talk to her. So I did. I walked down the hallway and I said, hey, I just want you to know, Dad's not hard of hearing. And, Dad's fully cognitively. She's like, I know. And I said, well, I don't want you to get upset with me, but I'm gonna show you what you're doing. And I spoke to her like she was speaking to him. And her eyes got huge and she goes, oh my God. I didn't even realize I was doing that. And she went in and she apologized to him. And they had the best relationship from then on out. And she was very understanding and respectful of that. So I've seen a lot of that in the past few days, and I've been trying to stay for shift change so they know exactly who he is, and I try to tell a quick little story about who he is so they know that he's a caring, compassionate person as well as a fully cognitively present person who understands everything that they're telling him. So my message is, I think this is the Fascia-Informed Therapist podcast. This is not specifically about fascia, but my main message here is just be aware. Just we have people, I'm sure, that listen to this that hopefully that work in lots of different kinds of settings, and not just settings like I work in a private setting where I can make my customer service and my interaction in any way that I want to make it. Because I don't live by productivity standards that other healthcare practitioners have to live by. I make my own. Of course, I live by that in terms of what gets created financially as well. I put half hour between every client because I never want to rush anybody out, and I want to be able to greet people as a rested therapist ready to help the next person. And that's not always an option in traditional healthcare, especially in a unit like Dad's in right now. Now, I will say that only one nurse kind of got snippy with with me when I was trying to advocate for him and ask questions. And that didn't last long, though. It didn't last long. He sort of turned it around and softened up and recognized that I was there because I love my dad, not because I'm trying to monitor his actions. And then I will also say that the therapy team, incredible. They were gonna get choked up again. And maybe here's the piece that the fascia piece comes in a little bit is he has so much spasticity, especially in his right leg, that it is really difficult to do range of motion with him. And I try to, when I get there first thing, which I'll be headed out there shortly, I try to give him a good stretch, and I offer it and he wants it. And but when the PT came in there, she was PTA, and she went so slow because I told her too, it was right leg, man, that is so painful when you start to move it. She went so slow with him. She got that leg straighter than I can get it most times. And it was wonderful because we know from the perspective of the body, the perspective of fascia, when you get the body into unique positions that it's not used to being in all the time, we get better blood flow, we get better fluid flow, the ground substance, and we get nutrition to the cells that need it. And man, she did a fabulous job. And then OT came in, they did a co-treat, they got him edge of bed, and they were so patient with him because my dad's an excellent groomer. He wants to brush his teeth and shave and wash his face, and they were so patient. They had a student kind of behind him, helping to support him, and Dad kind of kept telling her, less, give me less, I want to do it myself. Or they were offering to help, and he's like, no, I can do it, I want to do it. And they did help finish up the shaving and things like that, but it really truly warmed my heart to see the patience that they gave him to let him do those things, and the care, and they got that he was a compassionate, kind guy, and then they started to joke around with him, and he was laughing, and it was an incredible experience watching them work. And unfortunately, the next day they couldn't come in because he was having low oxygen saturation and kind of really struggling. And it's been a real roller coaster the last few days, where I was getting here quickly because, boy, that combination of diagnosis is pretty scary in an 85-year-old man whose body hasn't worked worked well for a long time. And boy, then things got kind of better, and then things got worse again. And I had one doctor telling me, gosh, we'll give him a couple more days, and then we'll look at a different direction. And there's really no other direction than hospice. And so, boy, that was hard to hear. And then the pulmonologist came in and was like, no, he's cleared the sepsis. He's cleared that infection. I can't even tell you how many times my dad has bounced back. But this doctor was like, we got to get him off the oxygen. And if he can get the oxygen down, he can go back to his residence and finish his course of antibiotics. And my dad heard that, and he started lifting his arms and gave me a high five, and he was super excited to hear that. So when I left yesterday, his oxygen saturations were up. He's still on high flow, but they were able to reduce it. I think was 5% is all, but at least the saturations were still going up, and that was a really wonderful thing to see. He was starting to have a little bit of, I don't know if it's the hospital deliriums, but he was starting to have some hallucinations, and I'm like, Dad, what's going on? Are you? Because he's had this before, but he's smart enough to know they're not real. But he asked me if one of my brothers was there, who was not there, the one that is not usually there. And I said, no, Dad, did you see him? And he said, yeah. And then he shook his head, and he said he's seeing people and things, but he knows he's seeing people and things. He knows the difference between what's real and what's not. But I told the nurse about it. I'm hoping that will get relayed to the physician. They can sort out if that's a medication thing or if it's still part of clearing the whole sepsis, and just some residual clearing needs to happen maybe in the brain. So anyway, I'd really have been trying to finish reading the article that I wanted to do this podcast on. But it's been so up and down the last several days that I've gotten through, highlighted, made some notes, but it will probably be next week. So anyway, I just wanted to kind of do this public service announcement to get people thinking. And if you're in traditional care or non-traditional care, reflect a little bit on how you provide your service, how you listen to people, how you gather information. That's another, I'll add this. The pulmonologist came in. He's like, I've got on my notes that he's a quadriplegic, and Dad again lifted his arms. And he's like, no, he can't use his arms very well, but he's not a quadriplegic. So anyway, pay attention, get information, ask questions, be curious. And my guess is if you're listening to this, you probably already really are curious. A curious practitioner who really cares about people, cares about doing the best job you can do, getting up-to-date information about what's new with the human body. And so anyway, thank you for listening. And I'm hoping I'm going to head there today and get even more good news, and we'll get to see Dad go home soon. So thank you again, and have a great rest of your day. You've been listening to the Fascia-Informed Therapist podcast. Be sure to subscribe so you don't miss new episodes. And if you'd like to go deeper, check out my continuing education courses, both online and in person. You can find them at fasciainformed.com. Thanks for listening, and I look forward to next time.